Your city, your county.
BBC Radio Leicester.
With the news, here's Joe Bostock. Morning, Joe.
Good morning. A grandfather from Leicester is stepping up his campaign to get the government to make a drug available on the NHS which could help to save the life of his 3-year-old grandson. Finlay Murby suffers from aHUS, a condition which causes strokes, heart attacks and particularly kidney failure. Trevor Murby is today taking a 30,000 signature petition to number 10. Professor Tim Goodship is the chair of aHUS Action UK. He says the drug transforms the lives of patients.
Prospect for the future is that we'll be able to stop kidney failure developing in those people who get it for the first time, and that we'll also be able to successfully transplant those patients who are on dialysis with the condition. So it's changing the lives of these patients quite dramatically.
Jonathan Lampon.
BBC Radio Leicester.
Good morning, it's just after 20 minutes to 8. Now let's come back to a story we were talking about just moments ago. And a petition which was handed into the government by a Leicester grandfather 2 months ago with 2,500 signatures on it is being resubmitted today with more than 20 times that amount. Trevor Murby's campaign centres around a life-saving drug called eculizumab, which is what his grandson Finlay has been taking for a rare disease called aHUS, a condition which can cause strokes, heart attacks and particularly kidney failure. But the drug is not available on the NHS, and the government has asked for an evaluation of the drug's effectiveness and affordability, which could take 6 months. Now, Trevor is planning on handing his new petition with 28,000 signatures on it to the House of Commons this afternoon. But before that, he came into the studio to tell me how Finlay is doing at the moment.
Oh, he's improving at the moment, especially with this drug that he's being given. It's almost like a silver bullet that it almost cures them instantly. So he doesn't have to go for his plasma exchange 2 or 3 times a week, and along with other patients that also get the drug. But it's not for everybody. The government have not allowed it for everybody, which is what we're actually campaigning for at the moment. And if you have a young child, you don't want to go through a funding request to get this drug. You want it on hand immediately so that your child can survive and live their life as normal.
Now, this is your second petition. Apart from the fact that you've got so many more people that have now signed it, what's the key difference between them?
Well, it's to pile more pressure on the government and to show how the public have responded to our petition, with effectively 30,000 in that. We also have an e-petition which has reached over 10,500 that also requires a response from the government. So we need to keep piling the pressure on so that they will make NICE give this drug for everybody that requires it.
And NICE is the National Institute for Clinical Excellence, who approve the drugs that are available on the National Health Service. Obviously, Finlay, as you say, has seen a marked improvement. You refer to this drug as a silver bullet.
Yes.
Does he know what's going on? He's so young, isn't he?
He's too young. He's too young. He's a very sturdy little boy. I mean, when he goes into the hospital, he obviously fights it because he's got to have an injection in his arm. But he only has to go twice a month now, whereas before he had to go twice a week or even 3 times a week for the plasma exchange and all the problems that created. And plasma exchange does not cure the illness, it only keeps it at bay.
Well, that's Finlay's granddad, Trevor. Now, joining me is Professor Tim Goodship. Now, he's the Professor of Renal Medicine at Newcastle University, and he's also the chair of the aHUS Action UK. Morning to you, Tim. How many people have this condition? We know about some of the effects causing strokes and heart attacks, but how many people does it affect?
Well, we think in the UK there are probably about 150 to 200 people who are currently affected by this. And each year, about 30 new people will become affected.
And effectively, what's going on? This is the idea of the condition which is blood clotting, isn't it? What's happening in the body?
Well, to understand it, you need to know a little bit about what the kidney does. So the kidney is a very efficient filtration system which clears our blood of the waste products. And it does this through tiny filters within each kidney. There are about a million little filters in each kidney. And each little filter has a tiny blood vessel in it, and the function of a kidney is absolutely crucial on those blood vessels. And in aHUS, what in essence happens is those tiny little blood vessels become clotted and the filtration stops. and kidney failure develops.
And it's a terminal disease too, isn't it?
Well, there is a significant mortality associated with it when it first presents, and therefore rapid treatment is really crucial.
Now, the rapid treatment currently comes in the form of eculizumab. Has it been effective as far as you're concerned? Have you seen it in action?
Oh, yes. I mean, the prognosis for this disease before eculizumab was very poor. Over 50% of patients within 2 years of first developing the disease would end up needing long-term kidney dialysis. And of those patients, even those on dialysis, transplantation was not a good option because the disease tended to recur. The prospect for the future is that we'll be able to stop kidney failure developing in those people who get it for the first time, and that we'll also be able to successfully transplant those patients who are on dialysis with the condition. So it's changing the lives of these patients quite dramatically.
And it's certainly changed the life of the 3-year-old Finley. I mean, his granddad says, he's like a different kid. He refers to the drug as a silver bullet. The fact that it's going to take 6 months and the government wants to make sure that it's effective and also affordable, do you have some sympathy with that?
Yes, I mean, I understand that in our health service there's not an unlimited budget, but the effect that this drug has on patients' lives is so dramatic that we really must try and make it available to them as soon as possible.
Well, thank you very much indeed for your time this morning. I appreciate it. Professor Tim Goodship there, Professor of Renal Medicine at Newcastle University. He's also the chair of aHUS Action UK. If you want to read up more about aHUS, it's www.ahusuk, that's aHUSuk.org. So that's www.ahusuk.org. Now, we did contact the Department for Health for a statement, and they said patients currently receiving eculizumab will continue to do so. The NHS England will consider any new funding requests until NICE, that's the National Institute of Clinical Excellence, has completed its assessment to explore whether it should be routinely available on the NHS. Well, those not receiving the drug will still receive treatment for their condition.